I'm going to do a couple more hearing tests, and then I'm going to inspect and assess your mouth and your head and neck as well. Okay, so I'm going to put this on your head, and I want you to tell me where you hear it, okay?
I hit on both sides.
Good. Okay, excellent. Now I'm just going to test your bone and air conduction in your ear, okay? So I'm going to put this behind your ear. Tell me when you no longer hear it, okay?
I can no longer hear it.
And then tell me again when you can no longer hear it.
I can no longer hear it.
Good. So that was about it was about double. Your air conduction was about double of your bone conduction, which is good. It's normal for hearing. Next, I'm just going to do a whisper test. So I want you to repeat back to me what you hear, okay?
Car rug boy.
Good, excellent. These are all right. We're just going to evaluate your mouth and your pharynx as well. So can you just smile for me? Good, even. Your lips look nice and pink. No cyanosis at all. The color's good. Do you have any tenderness in your mouth or any issues with your gums or teeth? No, okay. Can you, I'm going to use the light here. I'm going to have you open your mouth, and I'm going to shine the light in. Good, and you stick out your tongue. Good, so that's midline. And go ah. Excellent. So you still have your tonsils that I can see, and your uvula is midline. And your hard palate and soft palate are pink. And can you just lift up your tongue? Good. Excellent. And your teeth look nice and white, and it's nice and moist. Good. And your posterior pharynx also looked nice and pink. So I'm going to look at some of your, I'm going to feel some, I'm going to palpate some nodes that are in your neck, but it's not normal to feel them. So I'm just going to try and palpate them. So first is your preauricle nodes, which would be right here. Which would be right here, so I don't feel them. And then post-auricle, be here, and I don't feel any. And then I'm going to have you turn to the right, actually. Actually not yet, sorry, turn back. Good. I'm going to feel for any tonsillar lymph nodes, and I don't feel any there either. And submandibular nodes as well. Should be right under here. And I don't feel any. And then submental nodes. And I don't feel any there. Any tenderness at all when I was palpating?
Not at all.
And then we would do that on the on your right side as well. So next I'm going to have you turn right, and I'm going to palpate some, or see if I can palpate some more nodes on your neck area. So first, the cervical posterior superficial nodes, which I think is back here. I don't know. Just posterior, these are the posterior ones, cervical nodes, and I don't feel any back there either. And then you have a chain of deep cervical nodes here, and I don't feel any. And then, oops, no, sorry, this is the posterior superficial cervical nodes along your trapezius, and I don't feel any there. In your occipital lymph nodes, I don't feel any. And then supraclavicular and intraclavicular. And I'm not able to palpate any of those lymph nodes. So that's good.
And nothing was tender?
Mm-hmm.
And nothing was tender?
And nothing was tender. Good. So I'm just going to inspect your trachea and assess your thyroid as well. Good. So your trachea is midline, and it looks midline, it feels midline. And I'm just going to come behind you, and then I'll have you swallow for me. Good. Can you swallow? Good. So I could feel your thyroid too when you swallowed, and everything moved up together, up and down together when you swallowed. That's excellent. Let's do some range of motion of your head and neck, and also see how strong your head and neck are. So I'm going to have you do flexion, bring your chin to your chest. Good. And extension, look up at the ceiling. Good. And then rotation, bring your head to the right. Good. And to the left. Good. And then bring your ear to your shoulder. Excellent. And then on the other side. Good. Did that feel okay?
Mm.
Good. No pain at all when you were doing that? Good. So now I'm just going to test for some strength. So look to your left. Excellent. And your right. Good. And then back. Good. And then down. Good. So any pain when you were doing that?
Not at all.
No. Good. And so that's +5 strength in all areas. So let's see what else. Oh, your carotid and temporal arteries. So I'm just going to palpate them, and then I'm going to listen for bruits, okay? So good. So you feel them there. Good. And I feel them there. So I'm just going to listen for any bruits, irregularities. Good. Good. Those sound normal. I don't hear any bruits at all.